OSCE Introduction. OSCE setting, clinical practice, whatever the setting. I'm going to do it as a student because it's something that's relatively poorly done. And I mean it, honestly, it's seriously poorly done. And it's easy marks lost in an OSCE setting. There are a few components. You can use mnemonics like YPC, etc. But the thing is, you should know what to do and how to do. And the more you practice, the more natural it becomes. So, first and foremost, we go in, you wash your hands, and you say hello to the patient. I usually greet them using good morning, good afternoon, good evening, or hello if you like. That's your greeting done. I'm Zahir Abbas. Introduce yourself with your full name. Don't introduce yourself with your casual or slang name. Don't introduce yourself with your Christian or your full name only. Introduce yourself with your full name. So if your full name is Jonathan, use Jonathan, not John or Jay. If it's Ibrahim, don't say it's Ibrahim, whatever. And again, like I say, full name. And then introduce yourself using your title. I'm a physician associate. I'm a physician associate student. I'm a final year physician associate trainee. I'm an osteopath. I'm an osteopathic student, whatever. Okay. Can I please confirm your full name and date of birth? Patients often will give you their first name only and then date of birth. Make sure you get the full name. You are verifying the patient's identity. There are too many Muhammads around the world. There are lots of Daves about. So make sure you get the full name. Date of birth helps you again to verify the identity. But from a clinical standpoint, the date of birth is important. Why? Because you then have the age of the patient. You've got two choices here. Either you can stand there and try and do the maths. Under pressure, in an exam setting, nerves, probably get it wrong. No matter how good in maths, with all due respect. But why put yourself through that unnecessary pressure? Naturally, I would say to the patient, and how old does that make you? I've not done the work, and I've saved myself crucial seconds and minutes, or time rather. So, full name and date of birth, please. Mary Jones, whatever, date of birth, and how old does that make you? Wonderful. Am I okay to call you Mary? Am I okay to call you John? Do not call them by the first name unless you ask them explicitly. Very important to maintain that barrier and that professionalism. So, Mary is happy for me to call her Mary. Then you want to say what it is that you're here to do. Mary, I've been asked to conduct a whatever examination, cardiovascular, respiratory, abdominal examination. Now the patient doesn't know what that comprises. So that means, cardiovascular examination, this means I'm going to be listening to your heart and the sounds amongst a few of the components. The best word of choice here is amongst a few of the components, because there are various parts to this examination. You know, I know. The patient doesn't know. You can either stand there and talk them through all of those. Information overload, and by the time you got into kind of halfway through, they've forgotten the first lot. So when they then ask for, is that okay with your consent? They've kind of forgotten, or you're giving rise to the possibility of questions which are unnecessary, wasting crucial minutes and time. Don't bother. And a few other components. Is that okay with you? There's a consent. Mary, in order to do this, I will need you to remove your upper garment. I will be having a chaperone in the room. Are you okay with A, removing the garment, and B, the chaperone? Yes and yes. Would you mind doing that for me now, please? And then you ask the patient to remove the upper garment. You've already got chaperone. Remember, chaperone is for you. If you offer them, do you want a chaperone? They may well say no. Then you've left yourself exposed. And you don't give them an opportunity, really. Thing is, you're about to ask the patient to remove their upper garment. Don't say remove your top. Don't say, I would like you to take your clothes off. No. Very wrong choice of words. Especially when you're doing lower garment. I need you to take your trousers off. I beg your pardon. No. I would need you to. Not I would like you to. I would need you to. You need them to do that, not that you want them to do that. Be very, very clear. Choice of words is super duper important in these settings. Intimate settings, very, very sensitive settings. Your protection, less so theirs, your protection. Chaperone in the room, they do that. I personally don't offer them, do you need assistance with removing the upper garment or removing the clothes? Don't. If the patient can't do it, they will struggle, or they may, and just say, if you need any assistance, don't hesitate to ask. Khalas, that's it. Don't say, would you like for me to give you a hand with that? No. Again, there's a border between professionalism. Now, if the patient is clearly debilitated, then that's a different matter. If there's a clear physical disability, then it's a different matter. And in that situation, you said, if you need me to. Now, the other thing I've seen in practice is with the older patients, what happens is you are stripping them of their liberty by asking them, can I help you with that? You're making them feel rushed. You're making them feel unable. No, that is very, very important. You are undermining their physical ability, undermining them. And I have had patients who have outright said to me, that's what they've experienced, where they have been they felt pushed. Don't. If you need me, I'm just here. Don't hesitate to ask. I'll be more than happy to help. Done. And then, of course, you can move on. And now, the last thing in this whole situation is, Mary, if you want me to stop any point, don't hesitate to say, or if anything is uncomfortable, don't hesitate to say, and we'll take it from there, or we'll stop the examination. Here, again, it's part of the consent where that kind of gives the patient a reminder, a polite reminder, that they are not obliged to go through the whole thing. And if they feel uncomfortable or otherwise want you to stop for whatever reason, at any point, they can do so. It's a polite reminder to them from you. It's courtesy. Make sure you do that. And that's essentially your introduction. Now, I know it sounds very, very long, but this is how I personally would do it. So we use Mary Jane, and we use conduct a cardiovascular examination. And watch. Good afternoon, I'm Zahir Abbas. I'm an osteopath. Can I confirm your full name and date of birth, please? And Mary Jane says, Mary Jane, 1st of the 1st, 1954. Wonderful, Mary. And how old does that make you? She says 65, if that's what it is. I know it's not accurate. But, am I okay to call you Mary? That's good. Yes, she says. Wonderful. Mary, I've been asked to, thank you. Mary, I've been asked to conduct a cardiovascular examination today, which means I'll be feeling for your heart as well as listening to it amongst a few other components. Is that okay with you? And she said, that's absolutely fine. Now, in order to do that, Mary, I will need you to remove your upper garment and expose the chest, and I will be having a chaperone in the room. Are you okay to remove your upper garment for me, please? Yes. And are you okay with the chaperone? And she confirms again. Mary, I'll talk you through the examination as I go through it, because like I said, there are various components. And again, if at any point you want me to stop, don't hesitate to say, and we can absolutely do that. Is that okay? Absolutely fine. Are you warm? Are you comfortable? And she says, yes or no. Lovely. Thank you, Mary. I will now begin the examination. And that's your introduction. Done. You've got the chaperone, you've got the upper garment, you've explained the procedure, albeit very brief. You've introduced yourself, you've confirmed their details, you've got the date of birth, and you've basically ticked all the boxes of introduction. So it wasn't very long at all, was it? That, personally, is kind of the ideal way to introduce yourself, be it an OSCE setting or actual clinical practice. I hope that helps. Thank you for watching.